My name's Natalie and I'm a mental health nurse and I work in the homeless team. My role really came about because often or not the community mental health teams and housing, they had disagreements over what mental health crisis looked like and accommodation needs for those people. After some discussion with the CMHT and the housing department, we came up with my role to try and filter that bit in between. My job is really variable, so it can differ from day to day. A large majority of my role is working with rough sleepers. We know now that many rough sleepers have serious mental health problems. Really, very quickly, I can see those people and begin to work with them and get them engaged with services that they so desperately need. And that can be from the simplest thing, from registering with a GP.
Rough sleepers are not just confined to the New Forest. It's an issue across the whole of Hampshire, and there is hope that other local authorities will adopt similar collaborative working partnerships with the NHS to tackle this.
I might have a referral from one of the other departments. That individual might be facing the possibility of eviction. So again, it's looking at broader kind of issues and again, thinking about what services or what interventions they might need in order to prevent eviction. I work closely with the GPs and the primary care networks, the CMHTs, inclusion, and it is a real joint approach. And every surgery in the New Forest now has got a primary care network. If they're working with somebody who's facing eviction, they've got somebody that they can directly come to now, rather than phoning, being on hold, not knowing who to contact. So that's worked quite well. I have clinical supervision every month, and because I know the staff within the CMHT, if something has come up clinical-wise, risk-wise, medication, I know that I could go to them at any time for advice. I'm quite fortunate that, I'm kind of in control of my own diary and my own time. The great thing about this role, because if somebody needs or requires my time and I need to see them every day for the next 6 weeks, that's what I will do. I went into nursing to be with people, and that's exactly what I do. I'm working with people all day long. When you've met somebody who's homeless, they are rough sleeping, and then to see that difference of them in accommodation is quite overwhelming. It's a really satisfying feeling.